Hello, my name is Nicki Spears. I was diagnosed with sickle cell at the age of 6 months old. The sickle cell affects my everyday life as I have to be careful and I have to take care of myself better. I have to be in tune with my body and know what's going on with my body. I have to make sure that I keep myself hydrated, make sure that I don't get too stressed, and make sure that I eat the right things and continue to drink a lot on a daily basis. Both of my parents carry the trait. Otherwise, both parents would have to carry the trait. Otherwise, I would not be able to have the disease. At 7 years old was when I experienced my first sickle cell crisis. Well, my first one that I remember was when I was 7 years old. I'm told that at 6 months old I had a small crisis which did not require hospitalization, but at 7 years old I had a crisis that required me to be hospitalized. I had blood transfusion, and that was the first hospitalization that I remember. Definitely my sickle cell disease had an effect on me choosing to have a family. I had to make sure that the person, my mate, my spouse, did not carry the sickle cell trait, and so that I would be sure that my child was not born with sickle cell disease. I would never wish that another child be born with sickle cell disease. So that was one of the main things that my wife and I talked about before we decided to have our child together. And she did not have any trait or the disease, so we definitely did not. My son is not affected by sickle cell disease. Of course, he is a carrier with the trait, but he does not have the disease. Sickle cell affects my ability to exercise on a daily basis. It's not that I cannot exercise at all, but it's overexerting myself. I would not be able to overexert myself, so that would how my daily exercise routine would be affected. I never played any sports or never played any organized sports. I would play in the backyard with the other boys, but I would never play any organized sports because at that point I'm committed to the team, and I would not want to have to sit down and rest when I would probably need to. So therefore, no, I never played any organized sports. And how do I avoid extreme temperatures? It's not that I avoid extreme temperatures, but I just make sure that I dress properly for the weather. Sometimes, well, most times I'm cold when others are not cold, so therefore I keep myself bundled up, and I keep myself with a jacket. Most times I try to carry a jacket with me wherever I may go, and I wear t-shirts to be sure that I'm always keep my body warm. Anytime if I'm in extreme heat, I try to stay away from extreme heat, and definitely extreme cold. So those are the ways that I'm affected by the temperatures. Any advice that I would give to a person with sickle cell disease, my number one thing is that you have a relationship with Christ. That's my number one medication that I take, is that I have a relationship with Christ. The other things that I would have them to do is I would make sure that they know how to, and that they do keep themselves warm when it is cold outside. Make sure that they hydrate themselves at all times. Always keep something to drink, water, Gatorade, things of that nature. Always continue to keep yourself hydrated, and those things will help you as far as crisis goes. You also want to make sure that you have a doctor that you can develop a relationship with, that is interested, that understands your disease, and that will follow your disease and make sure that they understand the things that you need as a sickle cell patient. That's the advice that I would give to those who have sickle cell disease. Once again, my name is Nicki Spears, and I thank you for the opportunity to make this video.